Oh yeah, yeah.
Yeah.
Okay, we are in.
Let's do the sound check. Sarah, can you hear us?
Yes.
Perfect. Great. So then we will go ahead and
We can hear you too.
You can hear us as well, right?
Yeah.
You can hear me as well. Excellent. Thank you very much. Welcome, colleagues, dear partners and friends. Welcome to this side event on Impact Coalition, the future of drug policy, health and well-being for all. It's a great pleasure to be here and to be hosted by our now already friends, Affinity. We're very grateful to them for having provided this opportunity to us, given that the rooms in the HQ are quite full, and we have this wonderful venue for our discussion. My name is Billy Batware. I'm a program officer with the UN Office on Drugs and Crime in Vienna. And I'm joined, of course, with my colleague, UNODC Deputy Representative here in New York, and several other partners and friends of ours for this event. Before we start, I'd like to ask our friends from Affinity to welcome us. So, and of course, to thank you very, very much for the opportunities that you have provided to us, and for having been so open and welcoming of us already since yesterday in our meeting. So please, thank you so much.
Thank you, Billy. Yeah, it was a pleasure talking yesterday. Again, I know you guys want to get into the content, but we're very excited to be hosting you here. In case you didn't get the chance to stalk us online, Affinity is a 17-year-old data and AI company based in the United States with offices all over the world. We've been optimizing billions of customer service interactions to deliver more value, especially to very large enterprises and some government organizations to make customer service better. I'm sure all of you have had some pretty nasty, frustrating customer service experiences. So that's what we're trying to use data and AI to improve. And yeah, you're in our New York City headquarters, which is a really nice office. Make sure to take the awkward selfies in front of the windows with the great views. And yeah, again, we're just so excited to hear about generally more the UN's interest in partnering with the private sector, and hope that this is really just the beginning of a long relationship going forward. So welcome, and let us know if you need anything.
Thanks so much, Teresa. Thank you. Thanks so much, Andrea, as well, for making all of this possible and making the connection. Thank you. So, of course, the objective of this session is to discuss how collaboration between civil society organizations, academia, private sector can help us to address the world drug problem. Already, we started in Nairobi with this process, and this is the process, of course, we would like to take forward within the context of the Summit of the Future taking place already this weekend. And of course, looking forward as well to the upcoming processes. So we have a hybrid format. That means that colleagues also online are able to join. They will be speaking to us as well and engaging in this event. We would like to see this being a constructive discussion. As you can imagine, the world drug issue is it's not a very easy topic to discuss, but it brings together several voices and perspectives, and we would like to welcome those perspectives. So certainly being constructive and respecting each other's opinions and perspectives is quite critical for this discussion, and we're looking forward to that. And our host of the side event is the Vienna NGO Committee on Drugs. Mate, the Vienna NGO Committee Chair, is with us and will be giving opening remarks. That will be followed by our colleagues also from the New York NGO Committee, Summer Walker, who I believe is joining us online as well. And then we will hear from our colleague, the Deputy Representative of UNODC here in New York, also for welcoming remarks. So without further ado, I would like to ask and welcome Mate, please, for your welcoming remarks. Please, Mate.
Thank you very much. It's it's an honor and a privilege to be able to opening this session, the side event, and the whole process, as Billy mentioned already, started already some time ago. And for those who don't know us, Vienna NGO Committee on Drugs, we are a global civil society platform of more than 413 civil society organizations from 106 countries. So we are a global platform of civil society organizations in this field. And the whole process started already in the period of preparations for the midterm review, and especially with the discussions on the way forward. And there is a special chapter in the Global Civil Society report, which is dedicated to the way forward. And we set up some objectives, some ideas how to proceed with our work in the next few years. And then during the conference, Civil Society Conference in Nairobi in May 2024, this year, we established a so-called Impact Coalition for the future of drug policy. And the main purpose of this coalition is to showcase, to highlight good examples of collaboration between civil society and other stakeholders. So we don't work in isolated environments. So we have to work together. So we are here with this side event to present, this is the next step, and this side event will present some very good examples how it is possible effectively to collaborate between civil society, member states, UN agencies, and also academia in a way. And we will hear some of those good examples today. And of course, this is just one step further towards 2029 and the new political document, which will set up the whole process and objectives after the Agenda 2030 is completed. So the next step will definitely be our involvement and discussion at the second World Summit on Sustainable Development. So this will be our next step. So we will definitely try to work hard in this period between, before this World Summit in Qatar in November 2025, and maybe already bring some good results and even more examples of collaboration between different stakeholders. So I will try to, I'm trying to be short as possible to save some time and give the floor to invited and selected speakers here. So thank you very much. And Billy, the floor is yours.
Thank you so much, Mate. Indeed, being on time is one of the main challenges that we have today. We have incredible speakers with us who are going to engage with us during the panel discussion. We're trying to save us every second of the time that we have. And with that, I'd like to welcome Summer Walker, who is the Vice Chair of the New York NGO Committee, also to give her opening remarks. Summer, please go ahead.
Hi, thank you so much. Thank you to all the organizers and for everyone for joining today. My name is Summer Walker, and I'm the Vice Chair of the New York NGO Committee on Drugs. And in my normal hat, I'm the Head of Security and Rights Initiatives at the Global Initiative Against Transnational Organized Crime. New York NGOC is a substantive committee of the Conference of NGOs in Consultative Status with the UN. Very long UN term there. And we have supported civil society in engaging with the UN on drug-related matters since 1984, making this our 40th anniversary. As we mark the Summit of the Future and the beginning of the 79th session of the General Assembly, it's a time for reflection as well as a moment to push ahead. Since the UNGAS in 2016 and leading into the future, I want to highlight some of the achievements we've seen. Given the short time, I will just focus on two areas which are very relevant for the way forward and are very applicable to today's event. First, coherence across the UN system has grown. It's not perfect, but there has been an increase, such as through the UN System Common Position on Drug-Related Matters and the corresponding UN System Coordination Task Team, as well as more engagement at C&D from UN agencies based in New York and Geneva. Coherence is essential so drug policies and interventions do not undermine the UN pillars of human rights, peace and security, and develop, as well as the 2030 Agenda. Another example of cooperation is the collective efforts of the Vienna NGOC and the New York NGOC. Perhaps most well known is our joint formation of the Civil Society Task Force in 2016. Our long history of collaboration has proven crucial time and time again to making the voices of civil society heard. Earlier this year, we published a Global Civil Society report as an important input into the 2024 midterm review. It includes inputs by over 200 NGOs from all regions, representing a wide range of expertise. One key issue identified for the way forward in the report is collaboration across UN bodies to enhance coherence between the international drug control regime and international human rights obligations. A second achievement that echoes back to the title of this event is a stronger focus on health and human rights. Recent efforts to increase synergies include the right to health, including the Special Rapporteur on the Right to Health report on drug use and harm reduction, and their report on harm reduction for sustainable peace and development, as well as the Office of the High Commissioner of Human Rights contribution to the midterm review. We also saw harm reduction explicitly included for the first time in a resolution from the CND at its most recent session. This marks progress in bringing a health and human rights orientation to international drug policies, as well as coherence across the UN in this respect. It's also timely to note that members of the New York NGOC have followed and supported member states in the General Assembly, and particularly Third Committee deliberations on drugs for no less than a decade. We hope to see the achievements I've highlighted of greater coherence and cooperation across the UN system and with civil society, and an increased focus on health and human rights in drug policies included in the next omnibus. As always, we encourage member states to call on the New York NGOC and our members when we can be of support, both in the upcoming deliberations and with any drug-related issues. I look forward to following today's events as we push towards policies that are inclusive and evidence-based, and thank you very much.
Thank you very much, Summer, as well, for highlighting the importance of kind of looking, reflecting on what has been done and looking forward and what needs to be done. And I think this Impact Coalition is exactly for that purpose, to bring you as a community of stakeholders together to look forward and reflect on what you've done and how you can take these efforts forward, especially from outside the Vienna, let's say, a setting where the CND is based, so looking at New York and other opportunities as well. Thank you so much. It's now my pleasure to welcome and to introduce my colleague Matteo, who is, as I mentioned before, Matteo Pascali, who is a deputy representative of UNODC here in New York, also to give his welcoming remarks.
Thank you,
Matteo, please.
And before we start, I would like to echo your words of gratitude and thank Affinity for hosting us today, as well as all the members of civil society, organizers, permanent missions of in Slovenia here, as well as Nigeria, Uganda, and Kenya for organizing this very important and very timely initiative. In fact, as we gather here today, it's important to recognize the broader context in which our discussion is taking place, which is the Summit of the Future, which is to be held starting from this Sunday. And among the other issues, the summit will provide a platform to identify solutions to accelerate progress in the implementation of the 2030 agenda, while ensuring that no one is left behind. And the drug policy discussions we are having today are a vital part of this agenda, as you all very well know, and they directly influence global health, peace, and security. By aligning our efforts with the summit's goal, we are contributing to shaping a more just, equitable, and resilient future for all. Another issue that you are very well aware, because we launched it last June, are the findings of the most recent World Drug Report. And the document highlights that more than 60 million people are affected by drug use disorders, and only 1 in 11 in treatment. The troubling trend underscores the urgency of our work towards achieving the SDGs, particularly SDG 3, on ensuring healthy lives and promoting well-being for all. UNODC has been at the forefront of tackling these challenges, providing critical support to member states in the areas of drug use prevention, treatment, rehabilitation, and HIV and AIDS prevention, and reducing harms associated with drug use. UNODC also cooperates with a range of stakeholders to maximize the impact of our joint work, including government, civil society organizations, academic and research institutions, as well as the private sector, international and regional organizations, and other UN entities. And this is a very important aspect of our joint commitment. It is through this collaborative spirit embodied by initiatives like the Impact Coalition, which was mentioned earlier today, that we can make significant strides in combating the global drug problem. Preparation for the UN Summit of the Future, UNODC has been actively involved in various consultations and events that have shaped the summit's agenda, particularly in relation to global drug policy and organized crime. As part of its engagement, UNODC has facilitated key discussions and workshops across the globe, including its participation in the 2024 UN Civil Society Conference. This gathering brought together over 2,000 representatives from civil society across 99 countries to address the challenges of organized crime, corruption, and the world drug problem. UNODC, in this respect, played a pivotal role in highlighting the critical importance of partnerships between civil society and governments, showcasing its work through initiatives like the Impact Coalition. So these efforts reflect UNODC's commitment to strengthen multilateral collaboration and ensuring that diverse voices are incorporated into policy discussions. So we look forward to the dialogue and the concrete steps we will identify to guide the future of drug policy and contribute to sustainable development. I thank you for your commitment and participation, as well as the opportunity to share our views today.
Thank you very much, Matteo, for that. Also, again, for setting the stage of reminding us where we started with this process and where we're going with this. And as I was discussing with Matteo this morning, it's critically important that you as society organizations, but also ourselves as a UN, continue to position ourselves in partnership, also with the private sector to the next, to the upcoming opportunities already next year in 2025 and looking beyond already in 2029 for the review or the new agenda for sustainable development. Thank you so much, Matteo, for being here. Great, excellent. So now that we have gotten the openings remarks out of the way, I think we can now really look forward to very, very interactive discussion with our panelists. We have incredible lineup of panelists with us. And we have, of course, to make sure that we remain within the time, I would like to ask each panelist to remain within 5 minutes of their remarks. That's a challenge. I know you all have tons of things to share, great things to share, but I would like to ask you to remain within those times. So we have Marwa Yeli from Yehia, Public Health and Development Sciences Specialist from Metro Arabia, who will be followed by Vesna Marinko, the Director General of Public Health Directorate, and Dr. Yoche Ene from the Health Promotion and Addiction Prevention Division from the Public Health Directorate of the Ministry of Health of Slovenia. And then we will have Judy Chang with us, who is the Executive Director of International Network of People Who Use Drugs, who will be followed by General Mohammed Buba Mwara, who is the Chairman of the National Drug Law Enforcement Agency in Nigeria. And then we'll have Emmy Rosenhausen, who is Executive Director of the Drug Free America Foundation. With us, Ian Tennant will come next on behalf representing GI Talk, but also representing the Eastern and Southern African Commission on Drugs. GI Talk serves as a secretariat for that group. And then we'll have Brian Sekayombia, Principal with Regulatory Officer, Medicines at the National Drug Authority of Uganda, and followed by Yana Arsovska, the Director for the Masters of Arts program in International Crime and Justice at John Jay College. And last but not least, we will have Jiaven Tam, who is a research lead at Hyatt. As you can hear, we have a long lineup, so therefore we're very much looking forward to this. So if I may start already with Marwa Yehia for his, is it he, a she, I suppose, right? Is it a she? Okay, Marwa, I apologize for that. We did not use any indications of gender on the program, so I apologize for that already. Please go ahead. You have about 5 minutes. You are muted. Please unmute yourself.
Now can you hear me?
Please go ahead.
Hello. Okay, great. I'm gonna share my screen. Just let me know, please, when it appears.
Okay. We're waiting for the screen to appear.
All right, did it show?
It's coming. Yes, it shows now. Please.
Okay, great. Hello, everyone. This is Marwa Yahya from Mentor Arabia. Thank you so much for this opportunity. I am pleased to be a speaker today at this event. First of all, I would like to briefly introduce Mentor Arabia, which is a regional non-governmental organization that was founded in 2006, and it covers 22 Arab countries. It is a chapter of Mentor International that was founded in Sweden. The vision of Mentor Arabia is an Arab world where children and youth are empowered to lead healthy lives and make sound decisions. And we do that through implementing our mission, which is to empower these children and youth in the Arab region in order to prevent risky behaviors through capacity development, awareness, knowledge, and partnerships. So just sharing some numbers, Mentor Arabia has 85 strategic partners, 200,000 yearly beneficiaries, 1 million youth regionally. It operates in 17 Arab countries, and it has got 5 international recognitions, along with 45,000 social media followers. We implement our activities through 12 programs that we have, and the reach is 6 million youth globally. These are the latest numbers in Mentor Arabia. Now we're going to talk about some challenges that are faced by the youth in the Arab region. Basically, the primary health concerns in the Arab region have shifted from communicable diseases to non-communicable diseases, including diabetes, obesity, and mental health issues. Now, the risk behaviors that are associated with these NCDs basically are tobacco use, physical inactivity and poor diet, and road traffic injuries. And we can see that explicitly these are directly related to substance use. So, and further in the presentation, I'm going to explain exactly what is the approach that we follow in prevention and how is that related to these risky behaviors. So substance abuse is a growing public health problem worldwide and including the Arab countries in specific. However, unfortunately, data describing substance abuse in Arab countries is still limited, and I'm going to discuss some challenges that makes this data really limited. So first of all, to start with the stigma and cultural sensitivity. So this topic, which is drug abuse, basically is often seen as a taboo, which hinders the possibility of doing intensive research on it. The second challenge is the legal and policy restrictions. Due to strict legal penalties for drug use in many Arab countries, this fact discourages people from seeking help or even participating in research studies. Also, the lack of institutional support, and basically here we're talking about the insufficient funding in this regard that supports the research. Also, the inadequate research infrastructure itself. So many Arab countries lack the necessary research infrastructure, such as specialized research centers, trained researchers, and access to reliable data. Moreover, the political and social instability, and as we all know, the ongoing conflicts and political instability and economic challenges in certain parts of the region can limit research opportunities and divert the attention and resources away from the public health related issues or research, including drug abuse. The sixth challenge is limited collaboration and data sharing. So there is often this lack of collaboration, and this is what we're here to advocate for, collaboration and strategic partnerships in this regard. Last but not least, the focus on other health priorities. So many countries in the region are focused on non-communicable diseases and including maternal and child health, which may result in less attention and funding for substance abuse research. So moving forward to the multi-stakeholder collaboration and the sharing some success stories, let's say, away from these challenges. So I'm going to talk about Unplugged program. So Unplugged program is really a typical example for the impact of holistic or multidisciplinary collaboration and where did it really lead. So Unplugged, it was developed by UNODC. And then it was tested in 7 European countries until it was proven that it is evidence-based. After that, Mentor Arabia has came into this program and decided to adapt. Unplugged was only in English language. So Mentor Arabia has taken this program, and along with the efforts of UNODC, they adapted this program to fit for the Arab region. They have translated it into Arabic and adapted it to the context, to the Arab context. And then Mentor Arabia has trained RAS, which are the Royal Health Awareness Society in Jordan. They are also a non-governmental organization. They have trained the staff from RAS, and RAS, in their return, as trainers, they have trained facilitators from the Ministry of Health and Education in Jordan. And these facilitators were responsible to disseminate and implement this program in the schools. And in this way, we were able to reach a huge number of youth that have that their capacity have been built and their awareness have been raised in this in drugs prevention. Also, RAS, after Mentor Arabia has built their capacity in Jordan, they have trained another organization in Palestine. In Arabic, it is called the As-Sadiq Al-Tayyib. Okay, so and this organization also was able to implement this program along with the beneficiaries.
Marwa, if I may ask you to please come to the conclusion.
Yes, definitely. So concerning the responses to this to substance abuse and what is the methodology that Mentor Arabia basically uses or follows, it is definitely it is definitely a life skills prevention approach, which is a positive prevention approach in which we build the capacity and we of youth, and we empower them through giving them life skills sessions. Because as per the UNODC, the factors that make young people vulnerable or conversely resilient to the initiation of substance use or development of drug use disorders include individual and environmental influences on the development of children from a young age. And this is why our programs basically tackle or focuses on building the capacity and empowering these youth to be able to take sound decisions and shift away from using drugs. So basically, this is it as Arab, and definitely this is where it hits the SDG number 3, which is good health and well-being, which is one of the SDGs that Mentor Arabia targets.
Thank you so much, Marwa. Just in the interest of time, because I'm very mindful that we have several other speakers to speak.
Yes.
Please keep also additional points that you can also address during the next session, where we'll have a more moderated session. You can always come back to this point. Thank you so much for sharing with us how you and your organization are tackling the challenges, of course, regarding substance use among youth in your region. Thank you so much.
Thank you so much.
Our next speaker is Vesna Marinko, Director General of Public Health, and I believe also together with Dr. Yoche from the Health Promotion and Addiction Prevention Division in Ministry of Health of Slovenia. I believe.
Yes, good morning, everybody. Yeah, Mr.
Okay.
Jože Hren is also with me, and we are very pleased to be also, especially me, to be speaker at this wonderful event. I wish firstly to thank Vienna NGO Committee for organizing this event. Of course, in the next few minutes, I plan to share with you a couple of words on the importance of early prevention and on the role of non-governmental organizations in Slovenia. In addition, I plan to say a few words about the excellent cooperation with the UNODC when it comes to address the drug problem in a realistic and proactive way. Like other countries around the world, Slovenia is not immune to drug abuse. In responding to this problem, my country employs an approach that is interdisciplinary, comprehensive, and balanced. The Slovene Ministry of Health systematically promotes scientifically proven measures and cooperation among different stakeholders, including governmental experts, scientists, and practitioners from both public and non-governmental sector. A resolution on the national program on the illicit drugs 2023 to 2030, which was unanimously endorsed by Slovene National Assembly, promote all drug demand reduction services. This program clearly prioritized prevention programs, particularly early prevention, to achieve a measurable reduction in the number of new drug users, especially among young people. There is an increased awareness in Slovenia of the importance of prevention programs among decision makers, experts, researchers, media, and non-governmental organizations. It's essential that prevention activities are proven to be effective and that they treat children and adolescents holistically. That means strengthening their social and other life skills and empowering them to make healthy life choices. This contributes to their overall well-being and healthy and safe development. 2 years ago, Slovenia prepared a resolution on promoting comprehensive and scientific evidence-based early prevention. We see this side event once again as an opportunity to give greater visibility and importance to this topic. When we talk about this resolution, it is perhaps not well known that the original proposal for the content that we in Slovenia wanted to be included in the resolution was made by the NGO Utrip from Ljubljana, Mr. Matej Košir. At the Ministry of Health, we strongly believe in partnership, especially with non-governmental organizations and other non-profit organizations that operate in the field of public health. These organizations complement the healthcare system by reaching the most vulnerable population and by addressing health inequalities. Through public tenders, we co-finance programs that align with our national public health strategy, and we actively encourage networking and capacity building with the non-governmental sector. This is another concrete instrument through which we support the development and implementation of the early prevention programs in Slovenia. Let me now use this occasion to express our appreciation to the role of the United Nations Office on Drugs and Crime. In our different endeavors, nationally, regionally, and internationally, we were always in the position to count on a reliable cooperation and support by the UNODC. Besides that, continued fruitful cooperation, I wish to underline the importance of the international standards on drug use prevention prepared by the UNODC and WHO, which are at the very core of the developments of the science of prevention. To conclude, in our opinion, the future of drug policy, health and well-being is where science informs policy and where cooperation, equity and human dignity are at the forefront. It will be a future where we can build more compassionate, effective systems that promote well-being for all, especially the most vulnerable. And civil society organizations play a crucial role in shaping the future of drug policy, health, and well-being. They also serve as a key partners in holding governments accountable, ensuring that policies are evidence-based, equitable, and rooted in human rights. Thank you.
Thank you very, very much for that very comprehensive presentation. Also, I think thank you to Slovenian government for the leadership that you have certainly shown within the CND, within the Commission on Narcotic Drugs, and for being a good model for what is possible when governments partner with civil society organizations in this regard. And certainly, obviously, we at UNODC, we have this new initiative called CHAMPS initiative. If you're not aware of that, please look at that as well, which is, of course, promoting prevention of drug use among children and youth. And that's a very important program for us. And also, thank you for reminding us of the international standards. Thank you so much for the opportunity also for co-hosting this event. And with that, we move to Judy Chang, the executive director of International Network of People Who Use Drugs. Judy, you are going to talk to us about some of the UN Strategic Coordination Group. You're going to talk about to us about the UN Strategic Coordination Group on Drug Use, HIV, Health, and Human Rights, a multi-stakeholder platform. Please go ahead.
Thank you, and thank you to the organisers for inviting me to be part of this panel. So just as a quick introduction to International Network of People Who Use Drugs, so we're the global peak body representing people who use drugs, and we work to protect the health and defend the right of people who use drugs. So we are the constituency that are most impacted by current drug policies, which affect our health, our access to education and employment, our access to justice, and our freedom. So as mentioned today, I'll be drawing from an example of strategic coordination group, but also the Brandenburg Forum. So these are two examples of successful cooperation between a diverse range of stakeholders, including people who use drugs. So the first, it really emerged from an aim to accelerate commitment to global HIV targets, and then it expanded to, broader health and human rights targets as well. So the Strategic Coordination Group on Drug Use, HIV, Health and Human Rights, it's really a unique mechanism that convenes community-led networks, including youth-led networks, other civil society organizations, UN entities, member states, and as well as donors. So this SCG, we call it is chaired by Input, and we convene to work collectively and support efforts to achieve the ambitious targets agreed upon in the 2021 Political Declaration on HIV, as well as the Global AIDS Strategy of 2021 to 2026, particularly those related to societal enablers. So there's laws and policies that limit access to comprehensive HIV prevention and treatment programs, including harm reduction. We work to increase and sustain international funding, and also, of course, really center community leadership also. So some of what we've worked on collectively together, it includes a high-level panel on harm reduction at the Commission on Narcotic Drugs in 2019. We worked to shape and input into treatment standards and coordinate on funding allocations for harm reduction also. So as I mentioned, the second example that I wanted to refer to is the Brandenburg Forum on Drugs and Development Policies, which is again a multi-sector dialogue platform in the global drug policy debate, which really focuses again on human rights-centered approaches. And this is led by the Global Partnership on Drug Policies and Development, nested in GIZ. And it gathers governments, UN agencies, academia, and CSOs to exchange updates and identify common goals and strategize regarding the global drug policy agenda, and really focuses on the intersections and interlinkages between public health, human rights, and development, with a special focus on the SDGs. At each meeting, again, it's really focused on, action as well. So we focus together on making joint policy recommendations. And, one of the outcomes was the adoption of the 2023 Human Rights Council Resolution on Human Rights and Drug Policy. So really wanted to emphasize that, both examples really demonstrate how a small group can come together to really make progress on global goals and targets related to drug use and drug policies. So these multi-sectoral partnerships, that work on common agendas and priorities are very important, and they're really important in addressing the challenges of our time. I think particularly as we look at the, global environment today, there's real threat to multilateralism, and I think it's really by systematically engaging civil society and communities in regular interactions with the UN system and processes that broader society can really, understand the benefits of multilateralism and successful cooperation. We've seen this in the HIV sphere, we've seen it in drug policy, human rights, and development. Just wanted to point to, I think it was really disappointing that the Pact for the Future didn't include any reference to drug policies, given that we know that prohibition and the war on drugs really impedes progress on poverty reduction, access to food and health for people who use drugs and people involved in the drug trade, education, labor, peace, and justice. So there really needs to, I think, be more collaboration amongst all of us working on and interested in drug policy. You know, I think all of us are aware of how strongly connected drug policy is, not only to SDG 3, but SDG 5, SDG 10, SDG 16. And, you know, most of the major challenges that are listed in the Pact of the Future, for instance, you know, wars and humanitarian crisis, we know that illicit economies fuel this, including violence. We know that climate change is fueled by an unregulated market and production and has really severe impacts on marginalized communities. So I think, you know, in looking at the future, I think any development blueprints, you know, for the future should really acknowledge and recognize, you know, drug policy as a really key issue, and look forward to working with others interested in drug policy together on this. Thank you.
Thank you very much to the Chinese work for that good example. And it goes to show, you know, if you can have such a good impact as a small group, you can imagine how much of an impact you can have as a bigger group or smaller groups coming together to create a much better impact. And I think this is exactly what we're trying to do with this process here and with this Impact Coalition. Thank you so much for that. Our next speaker, yes, indeed, I think is online with us, General Muhammad Buba Mwara, the chairperson of the National Drug Law Enforcement in Nigeria. I hope you are with us online. General Mohammed Buba, can you hear us? Are you online? Okay. I don't see any sign of anyone giving me.
He's not here.
Hints. Okay, good. So we will move on then. We'll have about over 60 people online, so I might be missing some hands being raised for some speakers, so I would apologize for that. Of course, my colleague Sarah is in the background. She will also let us know. We have some questions also coming in the Q&A chat box, so we'll be looking at that also to respond to those. And if you're online and you have an answer or a comment to the questions that are being put online, please go ahead and interact as well online. Then we will move on to Amy Rosenhausen, who is the Executive Director of the Drug Free America. I think you're going to talk to us about an interesting opportunity that's out there as well, the so-called the Oviedo Declaration, and how this is amplifying the prevention efforts through cross-sector partnerships. Please go ahead.
Yes. So I'm Amy. First, I want to thank Infinity and the Vienna NGOC and all the partners for putting this together for us today. I won't talk about who we are as an organization. You can look that up online. I'll save it for the speech, and I've written it down so I don't get chided by Billy for going over time. The latest numbers from the World Drug Report highlight a worrying trend of increased substance use among young people and individuals with substance use disorders. Yet, as was mentioned earlier, access to treatment remains limited, with only 1 in 11 people receiving necessary care. What wasn't mentioned is the statistics are even more alarming for women, who face greater stigma, discrimination, and a lack of gender-sensitive trauma-informed services. As a result, in those cases, only 1 in 18 women receive treatment for the care that they need. These stark realities point to the urgent need for comprehensive prevention strategies as part of global drug demand reduction efforts. Prevention addresses the root causes of drug-related harms before they take hold, empowering communities to create healthier, more resilient populations. By intervening early, we can address the onset of substance use disorders and alleviate pressure on an already overburdened treatment and healthcare system. This year's World Drug Report, or World Drug Day theme, Evidence is Clear, Invest in Prevention, speaks to this very need. Evidence-based prevention programs offer sustainable, scalable, and accessible solutions. To ensure these efforts are effective, collaboration across all sectors, prevention specialists, practitioners, parents, schools, civil society organizations, local authorities, and governments is essential. By working together, we can build capacities, implement best practices, and promote sustainable integration of prevention into drug policies. Youth engagement is also critical to these efforts and is also lacking even in meetings like this. Young people must not only be seen as participants, but as co-constructors of prevention strategies. By including their voices and perspectives, we can develop interventions that resonate with their needs and realities, fostering on a culture of prevention that is both proactive and inclusive. A powerful example of this collaboration is the Global Initiative on Drug Use Prevention, the Declaration of Oviedo. This initiative, born out of a collaboration between civil society, government agencies, international organizations, and academia, aims to embed prevention into global drug policies. Since its formal launch in 2024 at the Commission on Narcotic Drugs, the declaration has gained the support of over 2,400 organizations and has been translated into more than 36 languages. Its 10 proposals serve as a comprehensive guide for integrating prevention into policy with the potential to shape national and international policies and strategies. One of the key proposals of the declaration is the reallocation of funding toward prevention efforts. Currently, global spending on drug-related issues is heavily skewed toward enforcement and treatment, with prevention receiving only a small fraction, if any, of those resources. The declaration calls for countries to dedicate at least 25% of their drug policy budgets to prevention, coming to a consensus by 2030. This proposal not only expands access to prevention programs, but also ensures that interventions are sustainably funded over long term. It emphasizes collaborations between policymakers, financial institutions, and civil society organizations to reorient spending priorities toward prevention, ensuring that resources are directed toward the most cost-effective and impactful solutions. Another essential proposal from the declaration emphasizes that prevention should start as early as possible, beginning from pregnancy and continuing through neonatal, childhood, adolescent, and adulthood. Effective prevention must focus on strengthening protective factors and empowering individuals on personal, emotional, and social levels throughout their lives. The CHIME model that Billy brought up earlier is a great example of this. Those collaborative efforts are between healthcare professionals, schools, and community organizations are vital in identifying the priority of intervention areas. Healthcare services can work with schools to provide early intervention education on emotional resilience, while community organizations can engage parents and caregivers to build strong family environments. This cross-sectional collaboration ensures that prevention is continuous and tailored to each stage of life, promoting well-being and reducing the risks associated with substance use across the lifespan. The momentum behind the Declaration of Oviedo is undeniable. It has sparked a global movement, highlighting the power of prevention and the need to incorporate it at every level. Regional and national consultations have already underscored the importance of prevention, with institutions and organizations sharing best practices and addressing common challenges. Now is the time to capitalize on this movement. We must continue to encourage collaboration and urge member states to officially recognize prevention as a priority. I invite all stakeholders to join this movement, to sign the declaration, to promote it within your countries, and together let's push for prevention to be fully integrated into global drug policies. Investing in prevention is not just a strategy, it's a commitment for a healthier, more sustainable future. And I'll end by echoing what the previous speaker said, that it really is a disappointment that some drug policy issues weren't integrated into a lot of these other meetings. And it really has to be in all high-level discussions, because we see this is something that permeates through all aspects of society.
Thank you so much, Amy. Right on time, just so you know. Thank you so much for that. And again, I believe UNODC is an observer to the to this Oviedo declaration, and I'll be perhaps during the Q&A afterwards interested to see whether some of these recommendations are already being implemented, that allocation of 20-25% of some countries, whether some countries are already opting to doing that, but we can engage on that during the Q&A session. Thank you. Our next speaker is Ian Tennant, the Director of Multilateral Engagement at GI Talk, which also serves as a Secretariat for the Eastern and Southern African Commission on Drugs. Ian, I believe you're going to talk to us about the work of this group in promoting practical actions towards more humane and effective drug policy. Please go ahead.
Thank you very much, Billy, and thank you to all the organisers that have brought us here today, including Affinity, who hosted us in the office, and UNODC, VNGC, all the other organisers. I'm speaking on behalf, as you said, humbly as to represent the Eastern Southern Africa Commission on Drugs. I'd like to start by recognizing the importance of the slogan of this meeting, health and wellbeing for all, and the kind of the objectives of the Impact Coalition that were discussed and agreed earlier this year. This is very much in line with what the Eastern Southern Africa Commission on Drugs is doing to promote reform rooted in human rights. The Eastern Southern Africa Commission is chaired by His Excellency, the former President Kgalema Motlanthe of South Africa. It's an independent regional high-level advocacy group championing drug policy reform across the region. Very briefly, the other commissioners are the Excellencies Joaquin Chissano, former President of Mozambique, Kassam Boutin, former President of Mauritius, James Michel, former President of Seychelles, Professor Kalisha Abdul Karim, a very esteemed academic, and Honourable Willie Matunga, the former Chief Justice and the former President of the Supreme Court of Kenya. So you can see we have a range of leaders from across the region. It was officially launched in Cape Town last year and has since held official meetings in Mauritius, Mozambique and Tanzania. All events have been co-hosted by the European Union, which generously funds the Commission, and the GITOC, for whom I work, which acts as the Secretariat. As a regional commission, just to explain, the Eastern Southern Africa Commission is working in partnership with the Global Commission on Drug Policy, which many of you will be aware of. The mandate of this regional commission is to enhance regional awareness around drug-related challenges, to engender public discussions, and engage with policymakers and other stakeholders, including civil society, to catalyse new approaches and reforms. While the discussions that they've had so far have been very diverse in terms of the issues they've addressed, very much like the work of the Impact Coalition, the common thread throughout has been a widespread recognition that past approaches to drug policy have not worked and have led to negative outcomes, including human rights violations and lack of access to medicines. At the same time, the enforcement responses have not been strategic or targeted enough to disrupt the criminal markets and its harm, which are increasingly pervasive in this region. And this regional commission has built on the progress that the drug policy reform movement has made around the world, including at the country level, but including at the UN. And we've heard some of the references to some of those movements that have, and progress that's been made. But there are three strategic principles that the Commission, upon which the Commission bases its work and builds on what's been done before. Firstly, first principle, I have three principles. The first one is that in order to make change on drug policy in the region, you need political will that's rooted in the region. Consultation, consensus building, and ultimately bringing people together have been key to the way that the commissioners have worked so far. And based on their credibility as individuals and their passion as senior leaders from the region who have all seen at first hand the harms of drug markets and drug policies in their countries. Secondly, this has been referenced by many speakers already, the lack of data and evidence is a real problem, especially in this region. In a recent Commission meeting, our chair, President Motlanthe, summed it up by saying, as a region, we think we know more about what is happening in our drug markets than what we really do. And it's this lack of data that's a fundamental challenge to the designing of effective responses. And we think it relates directly to deficiencies that the Commission has identified already, which is the poor availability and access to basic healthcare and treatment services for people who use drugs. The third principle, and this is based on those on the need for political will and the lack of data and evidence, is that the Commission has set itself up as a working commission. And what that means is it's not there merely to pronounce, it has to act, and it has indeed acted so far. It's engaged with civil society, with people who use drugs, with law enforcement, with academia, to commission new research and analysis on a wide variety of issues on which there is not enough data, on access to medicines, on the availability of harm reduction services, on trafficking patterns and enforcement responses, and on the diversification of substances and their harms. Armed with that data and evidence, they are better placed to advocate and to make change through the political and social influence that the Commission wields. Just to give a couple of examples before I finish, it's invested in local research to help convince leaders that their current understanding of drug-related harms has been not sufficient, and it's therefore supported civil society and parliamentary initiatives to introduce policy reforms, including a new harm reduction bill in Kenya and other regionally focused reforms, including a dedicated drug observatory drawing on civil society from the region. More recently, the Commission has convened what we believe to have been the first regional meeting on the legalization and regulation of cannabis, held in Mozambique and hosted by the presidents of that country in August of this year. The meeting brought together senior government representatives from the 7 countries that have already started making moves towards the regulation of cannabis in some form, alongside continental and other international experts from countries that have implemented a legalized cannabis market framework already. The idea behind this meeting was to encourage the regional countries to take action, to move forward in their efforts, and in doing so, to learn from the experiences of others who have gone before them. And from that meeting, we're already seeing a number of actions from the participating countries, which really demonstrates the value that a working commission based on data, evidence, consensus building, and with political will can bring. And we hope and we're sure that they will work, that their work will contribute to the ongoing work of this Impacts Coalition following the summits of the future. Thank you very much.
Thank you. Thank you very much, Ian, for that. And as I think you put it quite rightly, that political will is certainly key to success in our efforts to addressing the war drug problem. And interestingly, yesterday, as I was having a discussion with our colleagues from Affinity, and as I have this conversation with many other colleagues, lack of data, especially certainly in the African continent, we know this to be quite a challenge. And I'm sure this is an issue that many other countries are facing, but certainly in the context of Africa, we know that this is having a significant impact with regards to how do you respond to something without evidence or sufficient evidence available for that. And I think, again, there's this need for partnerships in our regards to improve those areas. Thank you, Ian. We will move forward to Brian Seka-Yombia, the Principal Regulatory Officer of Medicines at the National Drug Authority of Uganda. Please, you have the floor for 5 minutes. I hope that Brian is with us. I rely on my colleague Sarah as well, just to give me heads up if the speaker is online or not, and then we can move forward.
Brian is here. I'm not sure if you can hear us.
Brian, if you can hear us, please unmute yourself and go ahead. Okay. In the meantime, perhaps he's having some issues. We will just perhaps just go to the next speaker, and we will come back to see if Brian is able to speak to us. Yana Arsovska, apologize for butchering your name. She's a director of the Masters of Arts Program, International Crime and Justice at John Jay College. Yana, you're going to talk to us about an interesting work that you've been doing with your university on responding to drug trafficking, and predatory vendors in the darknet. So we're very excited about this, and I do think that I have your presentation.
I sent Billy 25 slides, and I saw him sweating. I also told him I really like to talk, so yeah. No, I'm looking here at the time. So thank you very much. And I don't know if you want to share some of the slides, but I'll tell the stories.
Please go ahead.
My name is Yana Arsovska. I'm the director of the ICDMA program at John Jay, and also research associate in our cyber security center. And we've been working in the past 5 years on an interesting project on darknet markets and drug trafficking on darknet markets. We receive funds from the NIJ and the Bureau of Justice Assistance to be able to understand how vendors and buyers connecting in these darknet markets. Billy, do you want to share the slides or no? Okay, yes, something so they can see. But so we know that in the United States, we have maybe around 100,000 plus drug-related deaths, and close to 70% is because of synthetic opioids. And this has changed significantly the drug market in the United States, because vendors that sell on these darknet markets, I mean, you don't have to be sophisticated drug trafficking organization. Sometimes you have two individuals pressing pills in their basement, and that's the level of knowledge they have. However, they're using very potent drugs such as fentanyl or carfentanil that are, 10,000 times maybe more potent than methamphetamine and so on. So these type of drugs are extremely potent, and if you don't have the experience or knowledge, right, of how to press the pills, this results in these increased numbers of overdose deaths in the population. So if you look at the dark web, and I don't know how familiar you are, but 96% of interactions are happening on the deep web. This is where you have anything that has password protection. However, the dark web is a subsection of the internet, and it's a very small subsection. Usually it's like less than 5%. Some estimates say even less than 1% of the overall internet, right? So at these specific places, you can access by just downloading a Tor browser, right? It's not that difficult. And once you are in the dark web, right, you will be able to see, maybe go to the next slide, if I think I have some, right, you can have the search engines like DuckDuckGo, and you can actually access the darknet via this type of search engines. You also can go to the next slide, have something that looks very much like Google, but it's called kilos. So grams, kilos, all of these are search engines that are allowing you to access everything that is sold on the darknet, right? Go to the next slide. Right, some of the search engines also will show you how many vendors are selling on the darknet, how many listings you have. And to the next slide, you get to something like Silk Road, for example. This is one of the first darknet markets that went down. But you can just shop and buy whatever you want to buy. So the interesting thing is that although we've had a lot of successful operations when darknet markets went down, new markets are constantly emerging, right? So we know that this kind of top-down strategy does not necessarily work. Sometimes it's necessary. However, what we need to do is figure out how these buyers and vendors connect on these darknet markets, and also make them aware of the dangers of the drugs that they are buying. So some of these vendors, you can go to the next slide, like, right, you have all these different operations, all these different darknet markets that exist, and we see that they're just emerging. New ones are emerging. Next slide. We also have something like what Dread Pirate Robert said, you can never kill the idea of Silk Road, right? Like this idea of darknet markets will always continue. So what else can we do? Like more the prevention side and awareness. And some of these darknet markets, such as Alpha Bay, I think is the next slide. So Alpha Bay actually, the administrator of Alpha Bay launched a fully funded harm reduction program on Alpha Bay. So what they did, because they had this issue of overdose deaths, and they wanted each vendor to list on the label of the product the ingredients that they have on their product, right? And then they also had something called drug checkers. So people that they will go test the drugs, 2 of them, so there is some kind of quality control. And then they're going to post an honest review about the drugs, right? So if you go to the next slide, I think, so you will see that some vendors will, for example, use code words to sell these different types of drugs. They will not use anything like fentanyl or fen, but they will use different code words. But there are also some vendors that are actually predatory vendors. So they are not telling the buyers what is in the product. So once you buy this product, you're just risking your life. So if you go to the next slide, right, you have predatory vendors. So then when you look at the reviews of the individuals, they talk about the product itself, that it has tested for fentanyl. And also the drug checkers that actually receive the tests and so on talk about the same thing. So this is how the administrators are getting rid of vendors that are predatory vendors on the site. And at the same time, we have a lot of civil society organizations. I think you can go on the next slide, and NGOs. Oh, this is like, for example, what will the vendor get after the team has concluded that is called the harm reduction staff at the darknet market has concluded that this is positive for fentanyl, despite the fact that they're saying there is not fentanyl. So then they remove them from the darknet market spaces. And to the next slide, and I will try to end there. There are all these darknet forums where actually NGOs have been participating and civil society organizations, because as I said, it's not illegal to download the Tor browser and get connected. And they have been actually proposing, maybe the next slide.
أنا مش سامعة ولا قاشع.
Next slide. So you can.
Marwa, if you could mute yourself, please. Thank you so much.
Yes, if you look at the next slide, so right, some of these organizations have been posting certain things that are helpful to the users themselves. So you have the harm reduction program from the actual vendors, but also organizations sharing what they can do. Ask a drug expert, physician thread on the forums, or something like the Russian NGO that was giving harm reduction advice and connecting to doing some outreach there and connecting to the buyers that wanted to understand more about how to use drugs safely and so on. So they were getting so many inquiries from people, and these conclusions were suggesting that users may be seeking assistance to be able to consume safely. And even though this is the darknet market space, we need to connect to these users somehow, because that is probably the only way that we can reduce the harm that's caused by synthetic opioids. Otherwise, it's just very harmful and so easy to get access to this. Am I within my 5 minutes? I should stop, right?
Yeah, I know.
I think, okay. Yes, I mean, you can go to the next slide, but I'm not going to talk. That's it. Thank you very much. Yes.
Thank you very much. Let me just stop sharing. Thanks so much for sharing just very practical evidence of based on your research. And again, it goes to show partnerships again with private sectors. We're discussing with our colleagues from Affinity and other private sector companies. And interesting point that you're making, that if these activities are within the darknet, we probably also need to be in the darknet to try to reduce the harm that is happening there. Very interesting point for discussion as well. Thank you so much, Anna, for that.
Yeah, very well.
Thank you. Now we move to the last, but certainly not least speaker, who is online, I believe. Yaven Tam, who is a research lead at Hyatt. The role of the UN agencies in enhancing regional cooperation and supporting human rights focused evidence-based drug policies in Southeast Asia. Please go ahead if you have the floor.
Hi everyone. I'll try to skip all the formalities. So I'm going to talk a little bit about transnational drug trafficking and specifically the death penalty. So, ladies and gentlemen, we live in a system where drug syndicates thrive while the most vulnerable pay the price. Our collective policies around drug trafficking have created this fertile environment where drug syndicates can exploit the reluctance of regional and cross-border legal actions and investigations. And this is very similar to the human trafficking issues we've seen along the Malaysian-Thai border. So for decades, Southeast Asia's approach to drugs has relied heavily on punitive measures like the death penalty and extrajudicial killings. But despite decades of enforcement, drug use and seizures continue to rise while real people get caught in between. Mary Jane Veloso, a domestic worker exploited as a drug mule, remains on death row in Indonesia, even after her traffickers were convicted in the Philippines. Kawan Singh, a Malaysian, was executed in Singapore for drug trafficking, while the syndicate that exploited him continues to operate. So these cases are not isolated, and they reveal a systemic failure that punishes the vulnerable while allowing real perpetrators to profit. Ladies and gentlemen, we need a new developmental approach to this problem. First, UN agencies need to be aligned in promoting a human rights-centered drug policy, starting with reviewing our engagements with states with punitive drug policies like the death penalty. While the UNODC advocates for evidence-based policies, this stance isn't completely reflected in the multilateral cooperation programs the agency has with retentionists is ASEAN member states. So this inconsistency must be addressed. The UNDP's access to justice programs also should be reconsidering their engagement in these member states. Development initiatives cannot be supporting justice while entangled in systems that perpetuate human rights abuses. So secondly, donor states and development partners should be ensuring that their funding does not support harmful drug policies, because financial assistance has been flowing to countries with punitive laws and indirectly sustaining practices like the death penalty with little to no consultation with national civil society organizations. So donor countries have a responsibility to align their contributions with the UN Common Position on Drugs and should support health initiatives, social integration, and human rights. So thirdly, I think we should be encouraging stronger mutual legal assistance and cross-border cooperation in Southeast Asia to combat drug syndicates effectively. Individuals like Mary Jane and Kalwan are not just victims, they are witnesses to the crimes these syndicates are committing. The UN Convention Against Transnational Organized Crime provides a framework for countries to collaborate in investigating organized crime, yet its potential remains largely unrealized in our region. Syndicates thrive on our lack of coordination, exploiting fragmented legal systems and weak borders. By enhancing cooperation, sharing intelligence, and aligning legal efforts, we can more effectively dismantle these networks. Finally, I want to urge all countries in Southeast Asia and the global community to support the upcoming UNGA vote on a global moratorium on executions. The death penalty has not proven effective in reducing drug-related crimes. Instead, it continues to take the lives of those exploited by syndicates like Cohen. A moratorium would create the necessary space for us to develop policies that dismantle these networks rather than punish those at the bottom of the chain. How can we be prosecuting drug syndicates when we are also actively executing witnesses to their crimes? Ladies and gentlemen, I think the way forward for drug policy in Southeast Asia is clear. Alignment among UN bodies, responsible funding from donor states, stronger regional cooperation, and support for a global moratorium on executions. People like Mary Jane and Kawan remind us of the human cost of getting this wrong. We owe it to them and to everyone else caught in this broken system to do better. Thank you.
Thank you so much, Jevin, for that intervention. And indeed, I think you did make the connection between the drug issues and the organized crime issues. And perhaps if you're not aware, if I would invite you to look at the opportunity that we're offering on organized crime. Next year in January, we're organizing a regional workshop on organized crime, bringing together various civil society organizations from within Asian region. So I would encourage you to look at that. It would be good to bring those synergies as well from the drug side of things into the discussions on organized crime. So thank you so much for that. Before we go into the moderated discussion, I understand we have Brian back in the meeting. So Brian, if you can hear us, please
Yes.
please let us
Yes,
know, and please go ahead.
I can hear you perfect.
Please go ahead, Brian.
All right, thank you so much. I really appreciate the Vienna NGO committee for inviting me here, and it's quite interesting. I think I've been listening to all the speakers, and I'm glad we are the other colleagues from the government, and so what I'm going to share is not very different from what they've been sharing. So I come from the National Drug Authority, and make sure I do it within 5 minutes. I come from the National Drug Authority, which is a medicines regulatory body established by an act of parliament, which is the National Drug Policy Authority Act. Now, within that policy, there is compliance with the international regulations on drugs, including the conventions on narcotic drugs and psychotropic substances under international control, and to fight against drug and substance abuse. So these are embedded within that policy that establishes that entity, the National Drug Authority. So it's within that policy that most of the things we do with drugs come from. And for the past few years, what have we been doing? We've done engagements, and one of the key places we've done is we've gone out to the communities as we were doing a lot of focus on young people, and we've been able to reach out to all communities across the country because we have presence within all the regions of the country. So we're able to reach out to as many youth as possible. We've done online engagements and we've done media engagements, both radio, audio, and visual. And these are proven very key tools to reaching out to young people and even families. We've gone ahead to meet youth through very interesting models, debates, where we build capacity of youth and then they go and debate, and some of these debates are televised. So we have practically communicated to other youth on the other side of the media using the same youth. Those are kind of peer-led engagements, and they've given us a lot of mileage, a lot of interesting results. We've done a lot of other peer-led interventions where we've gone and build capacity of young people to be able to reach out to their own. And the number of peer-led groups have been formed in different institutions of learning, the universities, the high schools, and very many are being formed, and we support them, giving them IEC tools and other tools. And here is where it comes in. We do a lot of collaborations. As a government, we collaborate with other partners, including NGOs. And NGOs have been key to the work we do because many times we've not been able to reach certain areas, and these NGOs have come out to us and we work with them to reach those NGOs. We've been able to collaborate with faith-based institutions to reach especially the families. And we've been able to reach international organizations like UNODC, where we've worked to develop standards on the messaging on prevention, and a number of CBOs within the country. And key to what we've done, we've been able to roll out different research to make sure that we're able to know the current drug situation in Uganda. Some of the things that we've also done, we've been able to lobby for policy shifts and policy reviews. And for many of us online know that recently Uganda passed the Narcotic Drugs and Psychotropic Substances Control Act 2023, and the National Drug Authority was key in having this policy formulated, which guides on the control, the trafficking, the cultivation of some of these drugs. So one other thing we've done is to map all the stakeholders that are in the area of drug and substance abuse prevention, so that we can know who is doing what, so that we can synergize efforts within the country. I'll finalize by saying what are we thinking going forward? We think we need to work more with all the interested parties, both NGOs and other government institutions. We need to form a central information repository. This can work within country, within the region, and within the continent, to be able to have a place where we can pick information we can use to do interventions. I must say thank you so much to the Vienna NGO committee for inviting us, and I would believe there's more we can do as long as we work together as a team, both government and NGOs. Thank you.
Thank you very much, Brian, as well, for finally making it into the meeting. I think you certainly had a very important contribution to make. Thank you so much for that as well, for setting at least explaining how you as a government are really going into the communities, and we know this to be the case in a number of other countries as well, which is quite critical to listening to these communities, especially young people. And I find working with faith-based organizations certainly also being a very important initiative, given the role that they play in many different communities. So thank you so much for that. And that concludes the panel discussion for this particular session, and we will move on to the moderated Q&A and a discussion based on particular, let's say, guiding questions. But just before we go, I just want to see if there's in the room, if there's any burning question, comment to any of the presentations that have been made by our esteemed speakers throughout this first part of the event before we move on. So I don't want to just move on if someone really has something very important that they would like to mention before we move on. Yes, sir, please.
Thank you very much.
So you can introduce yourself.
Absolutely.
Yeah.
My name is Vicenkovic. I cover global health issues at the Permanent Mission of Slovenia and the UN. Thank you very much for all the speakers, for the presentations, and just wanted to briefly add something that was already mentioned by Ms. Marinko regarding our collaboration, successful collaboration with civil society as a practical example on drafting the promoting comprehensive and scientific evidence-based early prevention resolution that was adopted in 2022. So the collaboration with civil society started at the beginning. The so-called zero draft team was composed not only of diplomats, but also of the civil society representatives, of scientists, of government representatives. And also from the very, very early beginning, we had support from the UNODC, who was instrumental, especially during the informal phase of negotiations with their expertise. And then all the stakeholders were consulted through the process, and it wouldn't be possible to adopt a resolution such as this without their help. The role of NGOs was especially important at the end of the negotiation process. We were trying to garner support, and it was instrumental, so the resolution was adopted eventually. And even after the adoption, in the implementation phase, the role of NGOs was critical and is critical. So I think this is a good example of cooperation between diplomacy, NGOs, governments in this multilateral setting.
Excellent. Thank you so much. Indeed, it sounds like a very comprehensive approach, already from the beginning, the design and the development of policy or a draft resolution, in this case, to the implementation. So, and everything in between. I think that's certainly what we all would like to see across the board within member states and within yourselves, because there are many of you and many different groups within the civil society groups as well. And I think seeing that collaboration is quite critical moving forward. Thank you so much, sir, for that. Any other comment, question before we move on? Someone online? Thank you so much, Yana. It's very important to pay attention to those who are online as well. It's easy to forget them when you are in the room. Let's see. We have David aboard, please. Please go ahead. And we will take this perhaps as a last point, and then we'll move to the next session.
Hi, thanks. This is David Borden with StopTheDrugWar.org, Washington, D.C. area. I found the dark web presentation fascinating. I have two questions. One, are there estimates for how much of the supply of the most or more dangerous of the drugs are going through dark websites at this time? And secondly, given that at least some of them have harm reduction features, are there policy recommendations or at least discussions taking place on the idea of is there a way to balance or thread the needle on the two likely effects of enforcement efforts? That is, if a site is shut down, that site at least no longer supplies those drugs, but the harm reduction benefits that might be there also go away. Thanks.
Thank you, David. You allow, so I think it's Yana. Perhaps I can ask you to make a quick comment on that.
Yeah, so I mean, in general, the percentage that goes via darknet markets is not a very large one. There are a few nationwide studies that show that out of the 100% of people, let's say, maybe around what is it called, 78% don't use drugs, but those that use the 90%, for example, get the drugs from traditional sources, and about 2% get the drugs in an online setting. And I would say out of all drug sales, it's about 10%, more or less, that go that are buying drugs online. Now, from those that are buying drugs online, I would say that it is a small percent of about maybe 30% that buy them specifically on the darknet market. However, still the number is significant because this is like a $3 billion industry. I mean, I had some slides with estimates where markets daily make about $2 million. So it's still a very significant number. But I would say that taking drugs from traditional sources is still the more prominent way of getting drugs. But you also see the trend because of anonymity and how safe it is to get this in a drug market setting, that the numbers are increasing. So the trend will be that more and more users probably will be comfortable doing this from their houses. And when we review their responses and feedback, rarely we see where they say, oh, my drugs didn't ship or arrive. Most of the drugs actually via the postal office gets to their door. So it means it's an effective and safe method of getting drugs. And it's also comfortable for the vendor because they are anonymous in most cases. Now, yes, we do have successful cases where the sites were brought down, but then immediately you see transfer to new sites. You have Silk Road, then Silk Road 2. You have Alphabay, now you have Alphabay 2. And then you have all these other markets that emerge. But also the tradition moves from market to market. So if there is some harm reduction strategy proposed by Alphabay, you see that also transfer to other sites as well. And the users are becoming more and more aware. But sometimes predatory vendors on these sites are finding different ways to communicate, and they're moving away from darknet markets to mobile apps and other places where they have less control from the administrators. So there are new ways, right? And it's evolving. It's something that we have to pay attention. But it is going to be a big market. I think a lot of users will start moving because of this cost-risk-benefit analysis. So I don't know if I answered your question, but yeah, I'll stop. Billy's giving me the...
Billy's giving you the look.
Yeah, the look.
Thank you so much, Yana. I think this was a conversation that we need to continue having. And again, it's a good opportunity that we're having this event in a private sector premises, because I think the private sector needs to be part of this discussion. I mean, the organized criminals in the darknet, they're adapting, they're very agile, they're very resourceful, they're very clever. And governments, on the other hand, they remain the same, are very traditional, going through, obviously, institutions, and they need to go through to respond to these challenges, which means that they take time until they can catch up with these organized criminals within the darkness. So I think the private sector then could certainly play a very important role to come in, developing these solutions to follow these activities and respond to them. So I think we can perhaps, as a follow-up to this event, we can perhaps agree. Andrea, I see you sitting there. We can perhaps organize another event more dedicated to discussing the partnership between the private sector and NGOs and governments, of course, on this and other topics that we find interesting from this discussion.
Absolutely. Welcome.
Thank you so much. So now we move to the last part of this. And as you can see, we had already dedicated 1 hour to this. I understand we started a little bit late. Some of you need to be in the HQ for the opening of the action days. But if you have a bit more time, perhaps we can take a couple more minutes to go through this last part. And it's a moderated discussion based on already guiding questions. So we already shared some guiding questions that we would like to discuss. We had wanted to first initially discuss each question for about 15 minutes, but obviously we're not going to be able to do that. So what I'm going to do is to have contributions, discussions around all these questions at once. So I would ask every speaker just to mention which question that they would like to discuss, that they would like to contribute to, so that at least we can collect inputs and suggestions on each one of these questions. So the first question is looking at what concrete, and again, to remind ourselves, Nairobi was a preparatory process towards New York, where we are today for the Summit of the Future. And the idea is to look forward even beyond the Summit of the Future this weekend to see what is happening in 2025 and 2029 and even beyond with regards to the Impact Coalition. So first question is looking at what concrete and realistic actions can be taken, including, of course, with limited resources, which is the case, and within perhaps giving ourselves about 2 years' time. You can look, of course, beyond 2 years. You can look within 1 year to promote and implement the key recommendations from the Impact Coalition meeting in Nairobi. And this could, for example, be looking at strengthening the capacity of relevant stakeholders involved in drug policy, yourselves and others, or, for instance, increasing partnerships. We're talking about the private sector, NGOs, academia, of course, governments, promoting health focus and human rights-based approaches. We've heard quite a lot about that today. What more can we do? And ensuring sustainable funding for such interventions. And so that's the first, it's a big question. There's a lot in that question. So I think we can collect a number of interventions on that. The second question is on how can we improve meaningful involvement of young people, people who use drugs, and other affected populations in policymaking processes through sustainable strategies and actions. So looking at those marginalized or special groups, and how can we involve them in these strategies and discussions. And the last question, the third question, is what concrete actions should be taken to strengthen partnerships between civil society, academia, the private sector, governments, the UN bodies, and other international organizations to accelerate. And if I may ask those who are online, if you're not speaking, please to mute yourself. Thank you very much. To accelerate the implementation of health-focused and human rights-based drug policies. Again, here, this question is also related to the first question in a way. So I think we can combine some of these questions. So we have, in preparation for this event, we had several people who had indicated that they would like to speak during the panel discussion, but we were not able to accommodate that. So we would also like to give them, some of them at least, the opportunity to come in and comment on this. And each one of you is going to have 1 minute literally to make a comment, suggest something concrete that can be done responding to each one of these questions. So I would start with Jorge Nabono. Is he online? In person, I think he was supposed to be here, but I don't see him here. With that, I will ask Vashti Rebon, who is online from the International Women's Rights Action Watch Asia Pacific. Are you with us? Vashti, are you with us online? Okay, I don't see Vashti online. So let me ask Rahma Amati Irakose, who should be also online. Hopefully. Again, I ask my colleague Sarah just to make sure that I'm not missing these people.
Billy, I think we have 2 people with hands raised online. Maybe we can take those first, and then see if others that would like to come in.
All right, thank you, Sarah. I will take that advice and go to Eze Uluchi, who is online. Please go ahead and just indicate which of these 3 questions you are commenting, responding to, and please take just 1 minute. Thanks. Eze, please go ahead.
Yeah, thank you very much. Thank you for the opportunity. I just want to say that I appreciate your initial comments regarding the issue of lack of evidence-based research in Africa, and I had said I suggested once that we should rather have experience-based issues so that we can enlarge the participation of African states in efforts at addressing drug problems. Then my other interjection is that in Africa we have a very peculiar issue. All African treaties have a column for people's rights. People's rights. So I don't know if we can expand the defense of rights, expand it from just being a human rights issue to being a human and people's rights issue, because in that way we are not just taking concern or interest in the individual, but we're also taking into concern the impact of substance abuse and drugs on the community and the society generally. Thank you very much.
Thank you so much, Eze, for being very precise and to the point. We're taking note of that, and if any of the other speakers who wish to take the floor would like to focus or to respond to that, please feel free to do so as well. Anyone in the room would like to take the floor? I'm just looking at my list, and most of them are not here online. But another online speaker was, there was someone else. Sarah, please help me with that. Otherwise, I will just go through my list again. Niyonzima Patrice, also online.
We have online, we have Brian from our panel who would like to respond, and then NJC who also raised their hand.
Angie.
NJC, not sure.
NJC.
Yeah.
Okay.
NJC.
Now,
yeah. Can you hear me?
Yes, please go ahead.
Hello. Can you hear me? All right. So my question is already mentioned in the Q&A. You can follow it. Thank you so much.
Okay, that's very constructive. We can take a look at that. NJS, right. Sarah, can you help me to find that question? And in the meantime, I will ask David to go ahead and respond.
So this is Brian, not David. Billy.
Sorry, Brian, please go ahead.
Okay, yeah. So I'm going to go to the children involving the young people. I think it's a matter of choices and being intentional. Now about over 10 years, I think experience dealing with young people has shown that when you let them on the table, when you bring them on the table, they are willing to express themselves to the detail. So it's about bringing them on the table, being intentional about it. I know the UNODC is now creating even a forum for them to discuss some of these policy issues. So I know this from an example where we've created debates and we've asked these young people to go and seek for information, and then they come and debate on issues of policy in terms of policy as it relates to drugs. So we've seen a number of interesting views, and some of these views we've used them to share, to build information into policy development. So it's about letting them on the table and being intentional, and then guiding them as they're on the table for what needs to be done. Thank you.
Thank you so much, Brian, for that. Again, I'd like to go to the room because some of our online speakers are not there. Anyone in the room who would like to address any of the questions for discussion? Yes, please, if you could introduce yourself quickly. And then...
Yes, I'm Leslie Greaves. I'm the founder and CEO of SuckDebt and SuckDebt Farms. Started off as a hemp cultivation company in Denver, Colorado. I'm also a member of the Veterans Action Council that works on drug policy and reform. Looking at the question number 2 regarding, how can we include people who use drugs? And, we see a lot of people that are on opiates using cannabis to get off opiates. So, I challenge everyone to think about these definitions. What is a drug? What is a medicine? And what is a tool? And how can we possibly utilize, especially plant medicine, as tools to combat the addiction of synthetics?
So is that a question? Was there?
It's a statement, but it's a challenge to ponder those sentiments.
Excellent. It also generates more ideas, perhaps for further discussion
Yes, because I mean, also like psychedelics, especially, some of the stronger, heavier psychedelics are really in those meditative states, allowing these drug addicts to really look at themselves and seeing how they're harming, self-harming. And a lot of times they walk away from that drug experience to drastically change their life. So again, I challenge everyone to look at, what is a drug, what is medicine, and what is a tool.
Very much. I think you were first, and then first we'll go online and come back to you. Please go ahead.
Thank you. Hi, everyone. My name is Mike. I'm Director of Strategy and Advocacy at Muvendi International. We work across the entire spectrum of harms that are caused by alcohol and other drugs: prevention, population level policy, recovery, service provision. And on the second question, I look at the question and I'm missing a few points. I think lived experience goes beyond people who use drugs. I think we should be able to involve people with lived experience. So people in recovery from alcohol and other drug use disorder, for example. I think we should be able going forward, as Mate said, until the Social Development Summit in 2 years, to involve the community. I think very often our discourse doesn't reflect what the communities want, what the people at the local level want. So I'm hearing here changes being made or narratives, and the people that are affected, they have actually other wishes, they have other ambitions, they have other hopes. So I think involving people with lived experience and involving local communities is very important. And Billy, if you allow me one more comment, human rights-based approach to drugs is really important. In Muvendi International, we are championing this. Human rights-based approach means that this is an approach that addresses all human beings. So the children, for example, the communities. And so I think we should challenge some of the UN agencies, UN programs, UN branches to look at everyone who is affected by the world drug problem. For us in Muvendi International also, of course, alcohol, SDG 3.5 is about narcotic drugs and alcohol. We don't see this yet, that all UN agencies engaging in this discussion actually have this kind of comprehensive approach, this human rights-based approach. And so I think it's about then making sure a human rights-based approach is our governments have committed to a responsibility to prevent harm when it's avoidable. And we have the tools to do that. So I think for the third question, these are two important elements. Thanks, Billy.
Thanks so much, Mike, for that. Thank you. Thanks, Leslie. Already mentioned, certainly at UNODC, we're increasing our capacity on working on issues related to human rights. Just recently, we now have a small team dedicated for that particular issue. And we were looking to continue increasing that. Obviously, as you mentioned, this is quite critical to provide and invest resources into that as a UN agency, because that allows us then to have the opportunity to engage with governments and member states in this regard. Thank you so much. Before I come to you, I'm just going to go to see if online Omo Yemen Lucia is online to respond to any of the questions. And Sarah, then I would ask you for your support in that. I see that looking at those who have raised their hands as well online, Paulo has also raised his hand. Paulo, please go ahead. And please do mention which question you're addressing. You're muted, Paulo, if you're speaking.
Okay, you can hear me now?
Yes, please go ahead.
Okay, thank you, Andrea. Thank you, everyone. Hello, dear friends. First of all, I want to congratulate you for this event and say many thanks for all your work in the community, and especially now say congrats for New York for the recent changes in the drug policy, especially in cannabis policy, and considering all the good relation of the humanity in cannabis for the multiple proposed medicinal, spiritual, and economic adult use, In the just recent prohibition, we have just 100 years of prohibition at UN level. What do you think are the steps for get back or natural right to use cannabis for our life? What you think is the regulatory or the main step to do it, to correct, to rectify these injustices? Thank you.
Yeah, I'm not sure. I believe that was a question, if I'm not mistaken. I'm not sure if anyone managed to capture. Was it related to the use of cannabis? Yes.
I did in the taste mode, my friend, if you want to check, because my English maybe is not the best. But my main question is what the board and all the participants think is what is the principal step to us ratify this injustice that we make with the cannabis, because all the humanity uses the cannabis for medicinal purpose, for spiritual purpose, for adult use, for all the history. But at global level, we have just 100 years for prohibition, and this for me, it's a very injustice with the humanity. In my opinion, we have the right to use, but my question my question for the board is what the board think is the principal step for ratify this injustice, to, for example, to get out for the list, prohibition list for UN, the resolution. What do you think we can do together for change these injustices? Because especially in the perspective of submission to the future.
All right. Thank you. Thank you very much, Paulo. I would just ask everyone who might have an opinion on that, perhaps to think about it. And the question is also in the chat. Please feel free to engage with that question in the chat as well. But please, if you have an opinion on that, keep that, and you can come back to it. Let me ask again, Doreen Mora online, if she would like to share with us any comment, solutions, responses to any of these questions. Doreen, are you online?
I don't think she's online, but there's one more hand raised. Renee would also like to chime in.
Okay, let's take Renee, and then we come back to the room. Renee, please go ahead. Renee, please go ahead. You are muted. Renee, if you would. That was not Renee, I don't think. Renee, you are muted. Please unmute and go ahead. Okay. As Renee is figuring it out, let's come back to the room and take some comments. Please introduce yourself.
Hi, my name is Silvia Ojeda. I'm the communications director at Medicineres. It's a non-profit organization based in Barcelona. We give shelter environments for women surviving violence and in situations of vulnerability that use drugs. And I just wanted to back up what you guys said, because we really believe that it's very important to understand the difference of drug, medicine, and tool, and that comes from asking the women we work with. We've had so far more than 500 women in our service, and well, for many of them, the drug use is linked to being a tool for something, or being a medicine for something, sometimes surviving violence, surviving living in the streets, surviving homelessness. And so for them, probably drug use is not the worst situation in their lives. We developed a material that's weed as a harm reduction tool, where we got all the information from the women. They were the ones who expressed why they used they used to overcome sometimes the need for opioids, but they also used it for menstrual cramps because they couldn't access medicine. You know, it was easier for them to access weed. So it's like we created this tool based on lived experience, based on what they have. And when you go to the question of how to improve meaningful involvement, we do think that it's important to validate people who use drugs and people who are in situations of vulnerability, to validate their knowledge. You know, not only go to the scientific evidence-based, you know, academic research, but also to validate their knowledge because they are experts on their realities. They are the ones who know the most their realities. So obviously what we did, like for example, with our weed as a harm reduction tool, was we tried to compare what it was evidence experience based and towards like scientific experience, the scientific evidence, right? And what we found that there was a lot of research done, and what they were saying happening to them without knowing that research. They knew it by experience. So we could pair up those two evidences. So I think we could involve a lot of the communities who use drugs and who are across by different situations of vulnerability, and to give this human rights-based approach is to validate their knowledge, do not patronize, do not condescend, you know, because most of the time what we see is that we come as organizations or people who work in these fields with an attitude in which we want them to be peers, but we don't really validate their knowledge as the same level. And what we end up finding is that a lot of the people, they end up believing that stigma, and they end up not validating themselves. So they tell you things and they are like, but am I right? Because I should not say this. Maybe, you know, so what I think it would be a game changer for like involving people, it's like validate them, acknowledge that they are experts in their realities, and be open to new approaches to finding solutions that are linked to their realities and not only to the way of or perspective of development that we have as organizations.
Thank you very much. Thank you very much for that intervention. I see Renee is trying to speak, and I would like, since even that many of the list speakers online are simply not online, I would just ask if anyone online would like to intervene, just raise your hand. So I'm not going to go through the list anymore. I'm just going to ask you if you wish to intervene, please raise your hand and we'll then ask you to intervene. So Renee, please go ahead.
Yes, thank you. I heard a lot about harm reduction. I heard a lot about human rights, but what about the children's right? I haven't heard about the Convention on the Rights of the Child, Article 33. No child should be exposed to the illicit production and trafficking of drugs. Children have the right to grow up and live in a drug-free environment. That can't be if we just push harm reduction. So please have a look at it for the future.
Thank you. Thank you very much, Amy, for that suggestion. Thank you very much. I see again, it's just Amy, Renee, still online. Okay, the hand is off now. In the room again, I come back to the room. There are several people in the room. All right, I see already 2 hands in the room. Please, ma'am, and then sir.
Thank you very much. I am Dr. Pasquin Bogunsoya from Allied Medical Services, Uganda. We provide comprehensive HIV and AIDS and SRHR services, including also harm reduction. So I would like to respond to question number 1. What concrete and realistic actions can be taken to promote and implement the key recommendations from the Impact Coalition meeting in Nairobi? From the presentations, we've heard that there is lack of data evidence. So can we have an M&E system that can real time track this implementation and also hold everyone, all stakeholders accountable to these key recommendations so that we can really track that these were the recommendations we made. How are we implementing and how can we confirm that it's really being implemented? And also, can we use, as my colleagues mentioned, that sometimes we do not recognize, we do not fund the community. Can we also use community-led monitoring to check that this is really happening? Because there is a lot of talk that let communities be at the center, but many times communities are not recognized. So if we can use community-led monitoring to check, you know, an M&A system to check government and all stakeholders that what we said we will do, we have done it in this time frame. Thank you.
Thank you very much for those two very concrete suggestions. Thank you very much. We're taking notes of all of that. Thank you. Sir, please.
Thank you so much. Hello, my name is Kerry James. I'm from the World Hepatitis Alliance. And we're a network of community-based organizations in 100 countries working for hepatitis elimination. And obviously, people who inject drugs are one of our major stakeholder groups. It's one of the main routes of transmission in many places in the world. And that is driven by criminalization of drugs, lack of harm reduction. I mean, this is a huge driver for us. And not only does it lead to high mortality from liver cancer, from hepatitis, but hepatitis is the leading cause of liver cancer in many, many parts of the world. So I think what's great about having these discussions here, and I think continuing these kind of discussions even next year during the NCD meeting, is drug policy doesn't just affect, individuals. It doesn't only affect communicable diseases, but actually the reach of it goes beyond it. And we've talked about human rights, we've talked about lots of other things here. So I think it's really encouraging. And it was great to see the presenter with all the different SDGs that this affects, and Judy touched on it as well. So I think about it in the wider picture, and we try to do that a lot for hepatitis. Hepatitis prevention and treatment is not just about this particular disease, but it's also the effect that it has on families. It's the effect it has on NCD rates. And I think drug policy also has that wide-reaching impact. I just want to reiterate that again today. Thank you.
Thank you so much, sir, for that. Before I go to Emma and Christina, and then I have two other people in the room. I have two people online, Nazali and JPL, that I would like to bring in. But first of all, I'd like to seek your help in understanding whether we should move forward beyond 12 o'clock. I would like to propose that we take an additional 15 minutes to finish. We started a little bit late, and I think we can, with this, the 4 hands I have in the room and 2 hands that I have online, we will take those as the last ones, and then we will conclude. If I have your permission to do that, and then yes, okay, I don't see any objection in the room, and I hope that there's no objection online as well. Nazali, please go ahead.
Thanks so much, Billy, and thanks everyone. Hello, my name's Nazli Maksudi. I'm chair of the New York NGO Committee on Drugs, and just so pleased to be here today. The NYNGOC is, of course, a co-lead of the Impact Coalition, a co-organizer of this side event, and just so happy to collaborate with our partners on this work. I thought I would just perhaps pick up on, I believe it's guiding question 3, that is about increasing partnerships and really looking at the different types of stakeholders, how we can work together towards more health-focused and human rights-based approaches. And I think it's actually a really natural segue from the last comment that was made in the room around the ways in which, while SDG 3 is the only one that explicitly speaks to the drugs issue, there are just so many of SDGs that are relevant to drugs and drug policies. So certainly SDG 3 is applicable, but for example, SDG 1 on poverty, SDG 5 on gender equality, 15 about life on land, 16 peaceful and inclusive societies, 17 on strengthening implementation. I won't list all of them, but the list can really just go on. And perhaps one of the specific ones, just to elaborate for a moment, is to say around SDG, about the poverty SDG, it's really been widely documented that criminalization of crops deemed illicit and the possession of drugs disproportionately impacts marginalized communities and the poor. And we've seen the entire UN system through the common position commit to promoting alternatives to conviction and punishment, including decriminalization of drug possession and the principle of proportionality. And that's something that we really saw come out loud and clear as well in our global consultations for the civil society report that was mentioned as a contribution to the midterm review. So I mentioned this because I think it speaks to not only the different types of stakeholders that we need to engage, but also this cross-sectoral collaboration, right? So this idea that needing and wanting to accelerate progress on the SDGs for drug issues means having to collaborate with groups in climate and gender, anti-poverty, peace groups, so many others. So as much as we can extend and collaborate across these groups and make clear the connections between drugs and these other issues and how drug policy impacts them, I think that would be beneficial for all of us in reaching our collective goals. Thank you so much.
Thank you so much, Nasli, for that. Also very good suggestion. In fact, I think we did a very interesting study at UNODC where we were looking at how can we, with a view to addressing, to contributing to SDG 3 on health, how can we address issues related to corruption, for instance, in certain regions or countries, where access to health actually requires that you practice corruption in order to access healthcare systems, and what happens when you're not able to fulfill those requirements, or you do not want to participate in that, right? So I think those synergies between various SDGs is certainly a very important discussion. Jiaven from Hyatt, please go ahead, and then we come back to the room. Please, unmute yourself, please.
Cool. Sorry. Hi, everyone. So, Javan from Hyatt, Malaysia. And I just wanted to take some time to respond to question 3. Actually, we work a lot with families of victims, like we call them human trafficking victims, who were exploited by drug syndicates and haven't really found any, resolution and justice. So, in context of question 3, I would like to just bring our attention to the need for cross-sector collaboration, right? To fight these syndicates without using the death penalty. So, coming from a civil society perspective, we can definitely provide this multinational first-hand knowledge of how syndicates have been exploiting vulnerable people across multiple countries, because drug activity is never just in one country, right? And people and academia can be providing evidence-based solutions to help us kind of shift away from relying on the death penalty to deal with transnational crime. I also wanted to talk about regional dialogues that we need to have on alternative justice. So I'm hoping that folks like the UNODC can help us kind of refocus our need for alternatives, right, in dismantling transnational syndicates. And this needs to be a clearer, more transparent cooperation with civil society, and just kind of help us move away from capital punishment, help us out in platforming, intelligence sharing, help us out in imploring regional other governments, namely Singapore, in hearing us out about what kind of witnesses are they potentially executing when certain crimes are being investigated in these countries, right? So it's just I think we can start with these sort of partnerships that, let's start with just not executing witnesses. Let's start with really platforming witnesses. Let's start with really focusing on investigations and kind of implore other governments who are also actively executing people to stop doing that. Yeah, that's my take.
Thank you. Thank you very much for those suggestions as well. We come back to the room, and hopefully we will stay within the 1 minute per person. And if we do that, we certainly finish on time. I start with you, Anne, please.
So mine was going to be 2, and I just wanted to highlight what's ending right now, which I believe is the 11th annual youth forum in Asia right now. Billy, you attended last year, and it's being attended by 150 youth from different countries around the region in Asia, and it's teaching them the science of prevention, but also allowing them to establish programs and ideas that then can be funded. So these are things that are not just, they're taking the lead, they're establishing what they want for their communities, and then giving them the opportunity and the tools to do that within their community. So I think that that's a way we need to do more to involve youth in that aspect. But then I'll touch on something that somebody else said, and that was, Article 33 and the rights of the child. And I think that that's something that we really, and this is probably not going to come across very well and might be controversial, but what we're doing in our communities is not prioritizing children and their needs. I have to drive 10 miles on my way to work, and in that 10 miles, I pass 11 dispensaries that sell marijuana. I pass many shops that are selling alcohol and tobacco. I don't pass any libraries. I only pass 2 places where you can get fresh food, and I pass 0 affordable housing. So people's basic needs aren't getting met, but we're allowing industries that are resulting in a lot of harmful things that are happening to our societies thrive. And I think that that's not giving our children or our youth the opportunities to thrive the way that they need to if we're not being able to provide them those basic needs. And those 10 miles that I drive are what most everybody in the globe would consider a very affluent city and area where we can afford all of those things, and we're still not providing them.
Very much. Thank you for that. And again, recognizing that the importance of this youth regional youth forums, which I think can be done in many other countries and regions. And I think yes, creating this environment certainly is quite critical. Thank you so much. It's a story that you're telling. You don't see libraries, but you see stores where in the end, this is what the kids do. This is the environments that they live in. How can we create a better environment for them? Thank you. Christina, please.
Thank you, Billy. Christina is my name. I'm president of Movendi International. And I would like to echo Amy, and I would like to also talk about, we should learn actually from the drugs that are legal, right? Tobacco and alcohol. And we should not be somehow misled by some kind of illusion that when we legalize drugs, then everyone will be fine, because we can see the harm that the tobacco and alcohol, altogether 11 million people yearly die, and many more suffer. Those who do not use it and those who use it. And I think this is something to keep in mind and understand how the population policies work and what we can do and what we cannot do once the markets are open and once the huge industry takes over and targets the most vulnerable ones that will not be protected. Yes.
Thank you, Christina. Thank you. So we had 2 interventions there at the back.
Okay, sure. Hi, I'm Raven. I'm a co-founder of a global organization called Community Care Collective. I'm based in Australia. I'm also a recovering drug addict, so this is a very passionate topic myself. I really believe that the usage of drugs is often a tool for numbing trauma. It's connected with mental health, gender-based violence, homelessness, and it's very intergenerational as well. What we're seeing. So much of society falls too much taboo and stigma that creates deeper shame to many whom are trying to survive. I believe there's a lack of information on the effects and impacts of these drugs. And a lot of countries, especially in the global south, like Pakistan, are not recognizing drug and a lot of this sort of language, which is, I feel like it's very important to share that and to look at that. We need more advocacy tools of awareness and community-led activities and empowerment for more coalition building and just, for youth to feel empowered and more like meaningful youth and intergenerational consultation processes that include youth voices and youth, just feeling like they can get out of that situation or feel like it's possible afterwards.
Thank you very much also for being one of the youngest in the panel to speak. And I think this is a question also the coalition needs to think about. How do you, as a coalition building communities, how do you bring in the young people and provide them that space to contribute and engage with you in this process? I have another gentleman over here, and I'm not sure if I have time for you, but let's go to the gentleman over there.
Thank you very much. I think I'm also one of the youngest here.
Yes, yes.
I'm representing the Measure Group for Children and Youth, but I also have a healthcare background. I research cancer. I'm currently in medical school and take one more comment about cancer and clinical applicability of our endeavors. I think it's crucial to include specifically this marginalized patient group. I say patients because at some point they will be patients. They will develop hepatitis, hepatocellular carcinoma. And I think it's crucial to get these patients into the clinical trials. Because clinical trials are the basis for our guidelines or treatment options that we have in the future. I think if these groups are not included, it's hard to treat them accordingly. And even children, as we have now, it's really important to get everyone on the same page and to get everyone.
Thank you very much for that. Mike, I have one other person who raised their hand online and you. So to be fair, I'm not going to give the word to any of you. So that we can finish. And I apologize for that.
We have closing remarks.
I apologize for that because we have closing remarks to be made. So we can chat over. I mean, all of us are going to be here, and we can just chat on that a little bit. So we will move to the closing remarks, and let me see. Where's my agenda? Yes, of course. Yes. We have our colleagues Carolina Akumada and Isaac Olushola who are online. Just to really recap a bit about what we have been listening throughout these discussions, listening to all of you. Just really to recap and kind of highlight some of the key points that was discussed today. Also looking forward. So each one of you has about a minute or so to just give us some of the key outcomes and points discussed from today. We'll start with you, Carolina. Please go ahead.
Yeah, can you hear me?
Yes, please.
Fantastic. Thank you so much. So the American Coalition on Drug Policy is a coalition of networks, NGOs, and civil society organizations working on the issues associated with the use, production, and trade of drugs considered to be illicit. The coalition's objective is to promote an informed social debate aimed at promoting non-punitive policies based on scientific evidence that respond effectively to the various problems associated with drugs. One of the primary challenges highlighted by NGOs in the Americas is the persistent non-compliance of drug policies with the international conventions and human rights standards. CSOs emphasize the need for a human rights-focused approach to drug policies, advocating for community-based action and a shift away from punitive measures. However, the lack of a systematic mechanism to address non-compliance creates a significant barrier, especially regarding the rights of people who use drugs and their access to harm reduction services. NGOs play a crucial role in documenting these violations, raising public awareness, and advocating for policies that respect human rights. It is essential to ensure the active participation of civil society and directly affected communities in the design, implementation, monitoring, and evaluation of all drug-related policies and programs. We reaffirm our commitment to placing equality and non-discrimination at the center of drug policy making by acknowledging the progress made, addressing the challenges ahead, and charting a direction for the future. We can build a more just and equitable society in which the rights of all people, including people and young people who use drugs, are defended and respected. Thank you so much.
Thank you very much, Carolina. Isaac, please go ahead.
Hi, everyone. Thank you so much and greetings from Nigeria. I'll be giving this closing remark on behalf of the African Society on Drugs. And on behalf of the African region, it is an honor to deliver this closing remark. And I want to begin by expressing our deep appreciation to the organizers, the Vienna NGO Committee on Drugs, and the African Civil Society Forum on Drugs, the UNODC, as well as the participating members from creating this valuable platform. And today's discussion have shown the immense power of collaboration in addressing the global challenges related to drug use, public health, and well-being. And today's discussion have also illuminated the significance of partnership across all sectors, the civil society, government, international organizations, and of course the academia in tackling drug-related issues. These partnerships are not just theoretical, they are practical pathways to progress. The examples shared throughout this event have illuminated the best practices that are making a tangible difference on the ground, from harm reduction initiatives to evidence-based drug treatment and social reintegration programs. These models of success serve as a powerful blueprint for scaling up and adapting to local contexts across our regions. And notable among some of the discussion and points discussed during the panel discussion was the collaboration and using high-level stakeholders to integrate and inform policy in Southern and Eastern Africa. These examples are not just inspiration to us, but they also provide actionable insights as we strive for progress. In Africa, we are acutely aware of the complex and multifaceted nature of drug-related challenges, from the growing rate of drug use among young people to the health, social, and economic and political implications on our community. And as we continue to strive towards the achievement of the Sustainable Development Goals, particularly SDG 3, ensuring healthy lives and promoting well-being for all at all ages, we must maintain our momentum. The progress discussed here today serves as a strong foundation for future action, and I encourage all of us to remain steadfast in our commitments to advancing these goals, especially in regions where the responses have been slower due to resource constraints and stigma surrounding drug use. Let us remember as Africans the ethics of our community, the spirit of Ubuntu. I am because we are. It is in this collective and collaborative spirit that we find the strength to build resilient, inclusive society. Our progress is not merely an individual triumph, but a collective achievement that uplifts our entire community. And by embodying this principle in our work, we can ensure that our policies and actions uplift everyone, leaving no one behind in the pursuit of health, dignity, and well-being. Civil society organizations across Africa are advocating for a comprehensive approach to addressing the drug situation, one that prioritizes the health and well-being of individuals and communities, offering a pathway to safer and healthier society. We as CSO would like to use this forum to encourage governments across the region to allocate adequate funding and resources in a manner that prioritizes public health initiatives. These will ensure that harm reduction, treatment, and evidence-based prevention programs are adequately supported. This message coming from Africa, especially the CSOs, is that we need more prevention activities and harm reduction services to our young population for drug use, as the resources are not enough. Those who end up using need to be provided with accessible, affordable, and comprehensive harm reduction services. As representative of the African region, we stand committed to continue this essential work. We recognize that the journey ahead is long, but we are encouraged by the shared dedication and resolve that has been demonstrated throughout this event. The knowledge, insight, and best practices we take away from today will not only inform our regional efforts, but also contribute to a collective global movement aimed at fostering health, human rights, and sustainable development for all. In closing, I want to emphasize the spirit of collaboration that has been cultivated here today. and that it should not end with this event. Let us commit to an ongoing dialogue, continue to engage, share, and uplift each other in our shared mission of fostering drug policy grounded in compassion, science, and a commitment to enhancing the well-being of every individual, no matter their circumstances. Together, we can create an unending and enduring legacy, a world where health and human rights are not privileges, but are as fundamental as the air we breathe. And before I conclude this closing remark, I would like to emphasize that this closing remark is as a result of the consultation done and suggestion made from every members of the civil society members of Africa. And we want to let all stakeholders and every government personnel here know that it is important for them to imbibe the spirit of collaboration with the CSOs. Thank you for the exceptional opportunity to present this and exchange and inspire each other. I look forward to the ongoing partnerships and initiatives that will come out from this discussion. Thank you, everyone.
Thank you. Thank you very much, Isaac. I usually don't like to kind of take, especially not the closing remarks. Great closing remarks, great summary, Isaac and Carolina. Thank you. Thank you so much. And it remains for me to thank all of you who are online, of course, and those of you who are here in person for having stayed way, way beyond the allocated time and sacrifice perhaps also your free time or lunch time before you head to the next session in HQ here in New York. And for those of you online going on for with your other activities, and some of you it's already late in the evening. So thank you so much for staying, for engaging. Let's take this spirit of collaboration and the collective action moving forward with this impact coalition. I'd like to thank the Vienna NGOC for bringing all of us together and all of the other co-organizers, including governments, of course, government of Slovenia, Kenya, and Uganda, and all the other partners as well. And of course, I'd like to thank very much our host Affinity for having us in this wonderful building of theirs. And I hope that this is also a start of another collaboration with Affinity and the private sector in general. Is how can we respond collectively to all of these challenges related to the world drug problem. You can be sure that UNODC certainly stands behind you and will remain as a partner of yours, certainly as a society unit, and the whole part of UNODC, including our colleagues here in New York, are going to be to continue to be your partners in this journey. So thank you very much, and all the best for the rest of the activities that you have, and enjoy New York for those who are here. And enjoy everything else that you're doing.